So we've got data sharing, collaboration, NHS app and standardization there, as well as ADHD patient portal and young people. So clearly one priority. So it's really good to see, it is really good to see that we're getting collaboration, people talking about collaboration, that we need to get far more into that space within the digital piece across London. And that's been one of the things we've been talking about regionally and around the need to drive far greater collaboration if we're going to tackle the challenges that are coming up for us, both financially, about the issue about variation in staff and their digital literacy and what they need, but also around the infrastructure that we have and how we solve that. There is absolutely a need that we start to collaborate much more closely as a region if we're going to solve these problems. And that's sort of what we want to do. We will take these away, absolutely, to feed back to trusts around how that feeds into the priorities we are working on, but also what we need to be doing next. We're wanting to build a community that brings digital leaders together as well as staff to understand what their needs are and how we can help them at a regional level, and how we can work with all across trusts to build a stronger digital system for London, rather than trying to think about this always at a trust level. And so we are doing Digital Once for London and bringing, the capability of London, which is unique in many respects, both from the aspect of having 9 providers, I'm going to say 9 providers in it, but also the universities as well, and using the unique capabilities of the universities and the providers to start to push forward on innovation and delivery and implementation around digital for our population in mental health. And we need to be doing that, basically, if we're really going to tackle those challenges. The money is going to be tight. It's not going to get any better. In reality, I was on a webinar with a provider from Melbourne last week. What was interesting, so they have exactly the same problems. They described increasing demand, they described no increase in budgets, but they also described a problem that we all have, which is they're unable to recruit staff. They had decided, rather than continually try to recruit staff, all their money for vacancies they put into digital. They decided, rather than continuing to repeat this recruitment cycle that they said was not working, they've invested a lot of that money into digital and have transferred and transformed their service to be very much a digitally enabled service as a provider in Melbourne. So the last few years, they've delivered huge reductions in that demand and access, improvements in access. The staff are feeling much more supported in what they're doing because, of course, that input and there's been increased productivity, and they could show improved outcomes as well, because they'd just thought about it in a very different way, where rather than thinking we've just got to keep filling those posts, which we're not filling, actually they were getting to a point, this is pointless. They said they had years of multiple vacancies across it, so what do they need to do that's actually different? So they partnered and thought about how does digital help us to do that and meet the needs of the demand coming through. But we've got an opportunity to do it even more differently in terms of actually how we can collaborate across aid. How do we collaborate across all the organisations, and how do we bring a solution that is fit for London is the thing. So that's what we're hoping to do. So thank you very much for today, and thank you to all our speakers, particularly thank you to Emma for stepping in at the last moment. I think probably got a call about 7 o'clock this morning or something to say, can she come and do that talk? So yes, thank you very much for all of you for your participation and your engagement throughout the day. I hope you've enjoyed it. We will be back in touch with everyone about our next steps of what we're going to be doing and the next steps for London. But thank you, I hope you enjoyed it. And please do fill in our feedback as well. Thank you.